Of course, we try to provide a strong basis of health knowledge to every one of our students, and then they would specialize in the individual fields in which they work. But what we found in COVID, I mean, this was such an acute and such a wild situation that, and you'll hear this in the speakers that speak in our event, that the entire hospital systems were completely changed over to be emergency care for COVID. That meant that regular treatments that people would be receiving, or elective surgeries, of course, canceled, but just the ongoing maintenance of areas were not being able to be delivered. People that were trained as say, physical therapists for a period of time could not deliver physical therapy because the patients weren't in the environments, and they didn't want to come, to be honest. People that had recent surgeries and would have wanted to have physical therapy, but everyone was afraid, and they weren't really willing to put themselves at risk, reasonably so. So that meant that physical therapists became support workers for other fields in health. Everyone rallied around the idea of what do we need to do and how do we do it as well as we can. And when you think about some of the aspects of our society today, where there seems to be a battle constantly, today happens to be election day. This is an example of where we pulled together, where society and all the fields in health really said, hey, I'm putting aside my personal concerns right now. We've got to work as a team, and we've got to save lives. And it was an incredible crisis that we had to rise to.